There was a high school survey that was done last year under the auspices of the University of the West Indies and the Organization of American States. And that survey resulted in tobacco being the third most consumed substance in our nation. It's second to marijuana. First is alcohol, then it's marijuana, then it's tobacco. And it is very important for us. Again, data is a magical thing, because with data you could do a number of things. And knowing that tobacco is the third most consumed substance, it means that the efforts that the National Drug Abuse Control Council is doing and should be doing to reduce the consumption of tobacco is very much important. So that's why what we're doing now is that we're concentrating on evidence-based program development and monitoring and evaluation of these same programs, so that we can, in 1 or 2 years, know the impact that we have been having in terms of our prevention programs in the country of Belize, including preventing the consumption of tobacco.
The consumption of tobacco, whether it's growing, would you say that it's a problem?
It is a problem. Being the third most consumed substance, it is a problem. But our interest, because of the data that has been provided to us, is that younger people are consuming tobacco. And this is where I want to link it with illicit trade. Because as we all know, we are importers of tobacco products. I mean, Belize is not a manufacturing, producing country. Even the made in Belize tobacco brands are imported from Trinidad and Tobago. But the fact that these are imported from Trinidad and Tobago and all the other brands are imported from the US or Europe, when they come into our borders through customs, they pay a tax. And that tax is very high. So when you are importing through contraband or through normal purchasing across the border, and you bring it into the country and you resell it, then that product is not gaining tax for the government. So what that means that the product itself will be cheaper. Cheaper means more accessibility, more affordability for younger people. So that is one of the areas that we will have to link. And linking it also means that younger people that are consuming are starting to show health risk in terms of the consumption of tobacco. The Global Youth Tobacco Survey of 2014 indicate that 6.5% of the overall individuals that were surveyed have consumed e-cigarette. In 2008 that we did this survey, that specific question was not included. But the National Drug Abuse Control Council and the Epidemiology Unit of the Ministry of Health felt that it was the right time to start to find out what are the trends of consumption of e-cigarette. And as I said, 6.5% is a considerable number of young people between the ages of 12 to 15 consuming e-cigarettes. And why is this important and alarming for us? Because it's the younger community, a younger community that has access to the media, to very well established campaigns from the industry. And one of the most famous campaigns is that the e-cigarettes are not harmful, and two, that they are not as bad as the regular cigarette. But the evidence is there, and it's medical and scientific evidence that indicates that it is as bad and as harmful. I mean, it's just that the e-cigarettes is covered by a very nice flavor, but at the end of the day, it still contains the same carcinogenic substances. It also has aerosol.